about Finkelstein test. These are the content of my video presentation. First, let's take a look on what is dicker vein. Dicker vein tenosynovitis is a condition that causes pain at the tendons on the thumb side of the wrist or radial styloid. This radial wrist pain at the tip of styloid process causes difficulty with lifting, grasping, and twisting activity involving the thumb. It occurs due to repetitive activities that maintain the thumb in extension and abduction posture, such as playing racket sport and also lifting a baby. The purpose of Finkelstein test is to assess the presence of dicker vein syndrome in persons with wrist pain, especially in those that present pain on the radial aspect of the wrist. Next, for the procedure of this test, no equipment needed to perform this test. Then, it can be performed in sitting or standing position. It can also be performed at bedside by hanging the hand of the patient at the edge of the bed. This is the original version of Finkelstein test. To begin the test, patient is seated comfortably and relaxed on the examination table. Then, ask the patient to make a fist around the thumb and perform ulnar deviation while the other hand rests beside the body. For the modified version of Finkelstein test, patient is required to sit comfortably and relax on the examination table. Then, place the hand at the edge of the examination table with the forearm in neutral rotation and the ulnar aspect of the wrist in contact with the table. For the first step, the patient pain is assessed with gravity-assisted gentle active ulnar deviation of the wrist. This version is suitable for patients who present in the acute phase. If the first step does not elicit pain, the examiner can gently apply an ulnar deviation force to the patient's hand. If the second step also does not provoke any pain, the examiner can perform the last step. For the last step, the examiner needs to grasp the thumb and passively flex it into the palm. If the patient feels pain that localizes over the radial styloid with any of the steps, it indicates a positive test and correlates well with the clinical diagnosis of dicker vein tendonitis. For the evidence base, according to Wu et al., Finkelstein test was more accurate than ECOF test as clinical examination for the diagnosis of dicker vein disease. It also demonstrated higher specificity, produced significantly fewer number of false positive results, and also caused significantly less discomfort to patients. The Finkelstein test also revealed false positive of 46.7% compared to ECOF test, which is 53.3%. The reliability of Finkelstein test with present or absence of pain revealed a moderate agreement with kappa 0.41. In conclusion, dicker vein tenosynovitis is a common painful condition that localizes at radial side of the wrist due to repetitive use of hand. It also can cause swelling to the tendon around the base of thumb. Therefore, Finkelstein test will be administered to determine the presence of dicker vein. If patient reports pain after the test, it indicates positive result of Finkelstein test, which the patient might have the dicker vein. That's all from me. Thank you for watching.